Integral Institute is launching a new 2.0 integral life practice. So what they're trying to do is find people who are applying integral in various aspects of life and get them to do a course or something like that. So I was approached about doing something on chronic illness, so I was taped on.
When were you approached? Talk about who you are.
I will. Well, David Rorden, I've been talking to him for a long time, and to Ken about integral health. I've been involved in family members who have been ill for decades. And I've also started a program at DePaul University for students with chronic illness. So I got to know about a lot of different illnesses, a lot of people's issues. And I ran that program for 7 years. And then I also taught some courses in chronic illness from an integral perspective, which people seem to love. They love being able to branch out into these different ways of looking at illness. So that's my background, and I'm planning to put on a course on this sometime in the spring. So one of the things I want to do at the end is ask you all for suggestions as to what you'd like to see in that course. So I'm going to start out today talking a little bit about the intersection of integral theory with chronic illness, and then I want to do some individual and little group practices for us to try to see through these windows ourselves. And then I'm going to talk a little bit more about some of my perspectives on illness and ask for yours. So that's the plan for today. Now, I do the one to the right? Yes. Okay, well, Ken Wilber has a very intimate connection with this issue himself. When he married his wife, Treya, within a couple of weeks of their marriage, she was diagnosed with stage 4 breast cancer. So they immediately were launched into this world of illness, and she lived for 5 years, and he cared for her and actually stopped working himself for a number of years to do that. So he just completely let go of his own career. You see?
96, was it?
No, it was like earlier than that, I believe, because I think they were married in like 84, so he probably died around 89. While all this was going on, he himself got sick. He was in Lake Tahoe in 1985, and there was an outbreak of chronic fatigue syndrome. The first one that actually attracted any kind of national attention, and he got sick at that point. So he was sick. At the same time, he was trying to care for his wife, and he is still ill. And as many of you know, he's had serious problems with his health. There were several years he spent in bed. I interviewed him about 10 years ago on this subject, and at that time he was still very ill, and commented that he just moved from the bed to the couch, and that was his entire life at that point. He tried to write. He would have a system where the computer propped up so that he could write. A lot of times he wasn't even able to do that. So he has a very personal interest in this subject. The reason I'm taping myself, by the way, is if I do put on this course, there might be some piece of this that might be useful, so I thought we might as well do that. So he has what's called MECFS. He's called it REDD in his writings before. You may have seen that, but it's a difficult illness. The name has been trivialized, and so I think he was at various times trying to find a better definition himself. But he's pretty much come back to the standard one. I also served on the board of the CFS Association, the National Association, for about 9 years. And at one time, he was going to work with us on doing something with that, but he was, again, not well enough to do it. So that fell through. Just a couple of things about chronic illness. Just as a definition, chronic illness is something that's long-term and has no readily available cure immediately in sight. 50% of Americans have some kind of significant illness. We're not talking about hay fever. We're talking about things like diabetes and cancer and heart disease and CFS and multiple sclerosis. Another thing about chronic illness, it's an incredibly intimate part of almost everyone's life, but it seems to be closeted. It's put over on the side as though that's not normal life. Oh, well, you know, we're all part of the Pepsi generation. There are these few unfortunate individuals over here who are ill, but that's really not the case. Everybody in their life just about at some point is going to get an illness. And most people know somebody who has an illness, either in their own family or in their group of friends. So it's amazing to me that it can be such an enormous part of our lives and be so little acknowledged. It touches us all. It touches ourselves. It touches our families, medical providers. There's, of course, an enormous number of people involved in the medical field. Taxpayers are funding medical care, and commerce is very involved. As you know, there are a tremendous number of ads for pharmaceuticals and who knows whatever. One other thing about chronic illness that's important is it does not fit the acute medical model. So for a long time, that's been the model. There has been, you come in, you go to the doctor, you get cured, and you go away. That's been and so people with chronic illness would just keep showing up, and doctors often have a hard time with this because they like to be successful like anybody else, and a patient with chronic illness doesn't give them that kind of success. Gradually over the last 10, 20 years, in my experience, there has been more attention paid to this. There are more options. Even the NIH is starting to have cross-disciplinary activities. They were set up by organ. So if something was wrong with your pancreas, you went over here, and if something was wrong with your respiratory system, you went over here. But chronic illness often engages many, many systems, so there wasn't really anywhere for people to go. But that is slowly beginning to change. So integral theory, just to run over the 5 major points, has quadrants, stages of development, lines, which means different areas in which one can grow and develop, types, such as male and female, or the Enneagram, and states of consciousness. So I'm going to go through each one of these and just talk about how we might relate that to chronic illness. So the first thing I want to look at is the 4 quadrants. These are windows that we can use to look at chronic illness and to look from chronic illness if we have it ourselves. So how many of you are familiar with the quadrants? Do I need to explain? Yeah, okay. All right, so the upper right quadrant, I'm going to start with there because that's the first place people go when they have a medical problem. They have something physical. They go to a doctor, they get tests. They look for specific material answers. They're looking at this illness from a physical point of view. The next stage they usually move into is what they call the inner objective, the lower right quadrant, where they're now in the institutions. They're in the hospitals, they're in the insurance system, they're in the medical system of one sort or another. And anybody who's been involved in illness knows that can just about take you over. So these 2 quadrants actually become a project. So people who get ill not only get ill, but now they've got an entire new job to do. Which is dealing with the doctors, dealing with the tests, trying to decide out what to do, doing research, going into the hospital, having procedures, trying to deal with their insurance company. It's an enormous task. So we have illnesses project in the right-hand quadrants. The left-hand quadrants, which are largely ignored by the standard medical profession, are about illness as trauma. Pat Fennell, who is a speaker on chronic illness and a clinician, has called illness itself a trauma. Just getting an illness is a trauma that you have to deal with. So you have your upper left, that's the internal experience. How do I feel about this illness in myself or in somebody I care about? What does this bring up for me? What kinds of emotions, what kinds of reactions do I have to this whole thing? And then the lower left involves us with other people. What happens to my relationships? If I'm ill or the person I love is ill, how does that relationship change? What kind of adjustments do I have to make in that area? And then there's the whole cultural thing. Our culture has a whole bunch of messages about illness. And when we are in that world, we find ourselves having to deal with them, like the Pepsi generation thing, for example. So you can see that we have many different ways that we can approach illness, and it's important to look at each one. Ken Wilber said, when I talked to him years ago, he said, if you don't address each quadrant, you're leaving something out that's really important. And each one can help the other. So if you get, if you're dealing with your internal emotions, it's going to make it a lot easier for you to deal with your relationship, and also easier for you to deal with the project aspects of things. If that doesn't happen, you're all tied up. If you, for instance, have a culture, or you are within a group of people who don't believe in a certain treatment, for example, which would be an upper right thing, and you decide you want that treatment, now you've got to deal with the relationships and the disagreements and all those kinds of things. So they're all tied in together, and one of the things you can do when you have an illness or when somebody you care about is try to look at these quadrants. Am I covering everything? Am I really checking out each of these areas? Okay, so the next thing is stages of development. Everybody's basically familiar with these two? Great. Okay, what a great audience. I don't have to explain. Like poor Ken, every time he talks about it, he has to go through the whole thing before he gets to it. So this is all in the upper left. It has to do with our interior experience, the development of ourselves, our growth, and our level of maturity, where we are. In our talk with Ken on Monday, I asked him, what would you think is the most important thing to include when talking about illness? And he said stages. He said they're never looked at. And he gave the example of, let's say you have 3 different people. We have one at the traditional amber level, and that person is going to trust the doctor. They're going to want answers from an authority. They're going to go in and say, tell me what to do. A person who's orange at a modern stage is going to go there and they're going to research, they're going to look for the scientific evidence, they're going to want the doctor to have that. That's the kind of experience they're going to want. A green person is going to go into the doctor and say, let's do this together. I have some ideas, I'm doing some reading, you have some ideas, let's work on this together. I'm as much involved in this as you are. Now this is great if you go into a doctor who matches your particular level, but if you don't, you have to negotiate this. And you have the same problem if a family member is in a different place. So let's say you're green and you're going in and you're working with your doctor and you've got all kinds of ideas about how you're going to handle this illness. But let's say you're married to somebody who's amber. And that person says, you have got to follow what the doctor says. Just go in and ask him what to do. So now you've immediately got a problem with the doctor, with your spouse or whatever. So it can get very, very complicated. So for example, here, a person who's at red is going to feel like power is a big issue for them. So illness is going to attack them in that fashion. They're going to feel, maybe I have to deny it so people won't think I'm losing my power. How am I going to deal with this? I need to assert myself with a doctor, all kinds of issues like that. An amber person is going to go to the doctor and say, tell me what to do. An orange person, the science, and the green about being partners. Now, all of us have all of those stages within us. So even if we're at the higher end of the stage, we still have within us those red feelings, amber feelings, orange feelings, and green feelings. And I think we need to acknowledge those. What part of me would just love to go to the doctor and be told what to do and stop thinking? What part of me feels like, I've lost my humanity, I've lost my power, that kind of thing. So those are things to look at as well. Look at the stages. Think about where you are. Think about where the people you care about are. And think about the doctor, because how you approach your physician is going to make a big difference in terms of the amount of information you get, the kind of information, how well you're going to work. So growth can take place in many different areas. And these are some of the most important ones. The cognitive almost always precedes everything else. People can be at a very high level cognitively and yet not have caught up emotionally or morally or things like that. So that tends to precede. People get an understanding of integral theory, for example, before they live it. Or they'll be at a certain stage cognitively, but not in every aspect of their lives. The cognitive is very important when you're dealing with illness because it has to do with perspective taking. Taking your own perspective, your family's perspective, the medical system's perspective, and understanding the complexity. These systems, the healthcare system is a massively complicated affair. And when you add to that the interior dimensions, it gets even more complicated. So the better cognitive skills you have, the more ability you have to take more perspectives, the better it is going to be for you when you're managing this plethora of aspects. So it's going to be relevant to diagnosis and treatment. How do you understand your diagnosis? How do you understand the treatment? It's going to help you to weigh options. Another really important line, which tends to be the second most important one, according to Ken, is self-sense, which this has to do with this emotional self, the psychological self, and the spiritual self. So this area is really important in terms of managing your emotions, dealing with any shadow aspects that you might have, and questioning spiritual beliefs. A lot of times people find that illness completely overturns everything they've believed about themselves and about their spiritual beliefs. So that can be another earthquake that happens in life. And then another, Ken talked to us about buckets. He talked about the cognitive bucket and the self-sense bucket, and his other bucket was skills. That some things like kinesthetic and musical ability are more like skills. But I have another bucket that I like to use, which is the relational bucket, which is about interpersonal reactions and moral development. So illness, again, can bring on changing relationships. It can cause one to have to deal with the impersonal aspects. You have a relation to the right-hand quadrants of the system, and then the left-hand issues as well, the relationship issues in the lower left quadrant. And then the cultural views of illness. So the more developed you are in each one of these areas, the better it's going to be. The more you're going to be able to do for yourself, the more you're going to be able to understand. Now, another thing that plays into this is types. As many of us know, many illnesses are weighted toward female or weighted toward male. So they're going to, if you happen to be a person, for instance, with CFS, there are more women than men. So one of the things that happened initially at NIH is CFS was put in the Department of Women's Studies. So if you were one of the 35 to 40% of men who had it, you know, where do you go? It didn't see. They have since moved it, and just recently I heard it's changed. And also, traditionally, doctors have given more respect to men than they have to women. Women have been treated as, you know, hysterical or whatever, or not, you know, their illness isn't for real. So there's been that kind of bias in the profession as well. And then we have types like Enneagram types, which some of you know very well. But this is, you know, you're a peacemaker type, you're a helper type, you're a self-promoter. That's going to affect what you do and how you approach it. And depending on the person you're working with or living with, that's going to affect the relationship as well. And then we have the Myers-Briggs possibilities there. So any of those can also be important. And then finally, we come to states of consciousness. And the gross state of consciousness is the first thing, again, you encounter with illness. It's a physical, what's going on in this material world, what's going on in my body or in somebody else's body. The subtle gets us into the world of thoughts, feelings, imaginings, wonderings, dreams, those kinds of things. The causal domain is about awareness of awareness. You are watching yourself with an objective, seeing yourself going through and doing various things. It's the witness. And that position gives you a different perspective on what's going on. And then non-dual, where everything is one. All of those are now one. One of the things I wanted to point out about this is my experience in dealing with health is really there are no bad guys here. Everybody is doing the very best they can and offering the best they can, and actually Ken confirmed that. He said, I have never met anybody, any single medical provider in all of my experience, he said he wasn't truly caring and wanting to help. And he gave a little story about this doctor who was begging them not to go do a certain treatment because he thought it was going to harm them. So I think having respect instead of, oh, they're all about greed or, oh, they're, this and that and the other, is not a helpful way to be, because I think you have to treat people, they're giving you what they know, and they don't know. If you're at an orange stage, you can't see green, and you can't see integral. You can ask things and you're going to get a blank wall, a deer in the headlights look. And most of the time in the medical profession, you're dealing with people who are at amber and orange. That's actually the center of gravity of our culture, and that's definitely the center of gravity of medicine. So yes, you can get another doctor, but sometimes you can't. And sometimes you have to figure out how to deal with the one you have. I think it does take goodwill, and it does take respect, and it also takes standing up for yourself, depending on what the situation is. So that's a big issue to consider. It really is. At one point, Ken suggested that when you go in to see the doctor, you have a list of things you believe he or she can help you with. They want to help, so what is it you want help with? Just go in and ask. Give them some way to be successful. I mean, if you're going to stay with this doctor, and give them some way to help. It's helpful. Okay, so the next question here is, which lines are significant in what way? We've kind of talked a bit about that already. It's important you have to be kind of cognitively on top of what's going on. If you sit back and, illnesses change, research changes, there are all kinds of options. It really behooves anybody to become informed so that they can have a discussion. And another thing to look at in this particular, are types relevant? Absolutely, because prostate cancer happens to men. So that's relevant. And then, and breast cancer. Although sometimes it happens to men, and once again, that's a situation where a man with breast cancer is now shoved into a whole world of women, which doesn't make it easy for him. And then another thing is to think about what spiritual practices can be helpful. I mean, if you're a meditator, can you increase your meditation? How can you use that to work with your upper left issues? Prayer may come into being in a way that people haven't thought about before when they find themselves in these situations. Visualization, yeah, that's being recognized by modern medicine now as a possibility. Right. So there are all kinds of things you can look at. So the next thing I want to do is all of us just take a minute yourself, and I want to go through these. Have some silence. Go through and notice your own contraction around suffering and illness, because one of the things I've noticed is there's a huge collective pushing away of illness, but I think that comes about because all of us have some of those kinds of feelings. So what I want to do is think about your body. When you think about illness, where in your body do you feel that? And I'm not talking about if you have a specific illness and your knee is hurting. I'm talking about what kind of reaction do you have? What kind of body sensations do you have? Do you tense? Do you want to reach out? What goes on in your body? And then what goes on in your mind? What kind of thoughts come through? When you think about illness, either of yourself or somebody you care about, what kind of thoughts happen? And then think about your relationships. If you're dealing with it, what is happening? What's important about that relationship? If you're not engaged in it directly, what sort of things can you imagine coming up for yourself as you deal with your relationships? And then your reaction to system. How do you feel when you walk into a hospital? How do you feel when you're dealing with an insurance company? What kind of feelings come up for you? Okay, so here's some things you might find in all of these areas. You might find anger. against the system, against one body, against other people, against a lot of things like that. Denial is very common, especially when somebody is first dealing with something. It's like, it's not, I'm just gonna fix that. It's not a big problem, it's gonna go away. Fear, big one. Guilt, I did something wrong, that's why I've ended up sick, or guilt if you're a caregiver, I'm not doing a good enough job, or I should, something like that. Love, it can really bring out of you a sense of caring for yourself and for other people. Gratitude can, when people show up and there's kindness and, you're treated with respect, you can be extremely grateful for that. And peace, there can be a kind of peace that comes with sometimes for me, the bigger the trauma, the more at peace I am. The things that drive me crazy are some, little annoyance, like somebody ate my cheese, or something like that, and I can get really annoyed. But some of the big things, you realize it's big and you can't do anything, so you kind of settle in. All of them are okay and they vary, time, place. Same person can have all of these reactions at different times, but just again, being aware that they can go through and looking for patterns. If you're always angry about everything, have a look at that. If you're, feeling hugely guilty, why? So notice any kind of particularly heavy patterns that you have. So this goes back to relating to the other person. And so I put up some little phrases that people get when they get sick. So you'll be better in no time. My sister-in-law did this special diet. Get a good surgeon immediately. You want to get on top of this. Don't have anything to do with the medical system. It's all based on greed. There's a lot of new research out there. You should look it up. I heard about this clinic in Mexico. You must meet with Dr. Blank. I read this article about supplements. I'll send it to you. If you were more spiritual, this wouldn't have happened to you. Ken gets enraged about this one, absolutely enraged, because that's what Treya was given, that sort of thing. It's all tied up with your relationship with your father, I'll bet. Or mother. Let's see, the liver, that's associated with anger, right? So, how do you think you'd feel if in the first week of your diagnosis you get hit with this? It's just overwhelming. So these are common reactions: denying, fixing. That's when my son got ill, that was my thing, fixing. I'm gonna fix this. I'm gonna figure out what's wrong and I'm gonna fix it. And blaming. So it can lead to we've heard of spiritual bypass. There's like a suffering bypass. People don't wanna confront suffering. They don't wanna confront the possibility of long-term difficulty. So they bypass it. They push the person away with suggestions or handing them something, or making it about healthcare and, oh yeah, well, I don't think much of the system when you've got a suffering person in front of you. So you end up with all of those kinds of reactions. You can also get the person overwhelmed and confused. They obviously can't research every single one of these things, so what do? And also when people push half-baked, oh, I think I read something, it's not really very helpful. It can also lead to pressuring the person. Oh, my father-in-law had this, and this is exactly what he did, and you have to do that. You really have to do that. And you start pushing people, or you got to change your diet. What do you mean eating that? You're sitting in front of me and you're eating ice cream, and it's supposed, all that kind of thing can go on. And it can also give false hope. If you start telling people all of these stories about this person succeeded with this and that and the other, they can start to feel, hopeful in a way that maybe isn't realistic. So it comes from fear. When we encounter illness, we have denial. We want sometimes to put a distance between us and the illness. We can feel inadequate if a person is really ill and we don't know what to do. We can fear losing this person. So that sets up a whole problem, and a fear of seeing somebody suffer. So that's why we want to push it away. But it also comes from love. We have a desire we want to help people. We want to share in their pain. We want to be there for them. So sometimes offering all these things is a way of doing that. We don't know what to do, so we come and we offer whatever we have. So it's hard. My early years in dealing with illness, I tended to get just fed up. You know, it was like, don't you think I've been working with this for 10 years and you're coming here and telling me if he only eats asparagus, he's going to be well? I mean, you just start to get a little, you know. And then I began to realize later this does come from a place often of caring and appreciate that. We appreciate the fact that the person is reaching out. So some other ways of approaching people is to focus away from this limited view of cure or solve. Like, I have to solve this for you, you have to be cured. And go to the left quadrants, and where you listen and maybe you make somebody's life a little bit better. There's a movie called Seraphine, which is a French movie, and it's incredibly slow moving, and like a lot of French movies are, but I had to watch it in segments because it was so slow. But it's about a woman who had a serious mental illness, which worsened over the course of the movie, but she was also a brilliant artist, and she was working as a house cleaner. And a man discovered her, and he was in the art world, and he took her art and he showed it. And then the World War II intervened, and he was German, so he had to go back to Germany, and she continued to get worse in one way or another, but her art got better and better. And he came back, and eventually she ended up in a mental hospital. And he was distraught, you know, for not being able to, he was showing her art and she wasn't participating, and he didn't know what to do. And he went into the place where she was, and he got her a better room so she could look out at her beloved nature and that sort of thing. And it was, the whole point was make somebody more comfortable. Even if you can't solve their problem, you can do a little thing. And that movie really touched me in that sense, that nothing you do is, just because you haven't solved the whole problem doesn't mean that you can't offer something that's valuable. So I liked that. And then I thought another thing to do is thinking about caring for one person as just as important as caring for everybody. People think they have to go into, I got to do a global program to solve illness, but no. We learn from the individual. We learn about care from dealing with individual human beings. And I think there are a lot of things that tell us this. There's the comment about God cares about every sparrow that falls. And the one about what you do for the least of them, you do for me. The idea of a hologram, that within each person is contained the whole. There's a literary term called synecdoche, where the part stands for the whole. And then there's this phrase, there's a world in a grain of sand. It's Whitman, right? And then the movie Schindler's List is stuck in my mind for, at the end, he keeps saying, if only I could have gotten one more, just one more, just one more. So the idea that helping one person isn't important, I completely disagree with. Yeah.
When my mom had a bad stroke, there was members of my family that concentrated on the physical part, and they, to me, ignored her mental needs and her emotional needs. And so I didn't think she was, at the end, as happy as she could have been.
Yeah, I think that's a good point. And then sometimes it's different people who can bring those different things. Some people, you know, can bring physical help. They can help make meals, or they can fill out insurance forms. And they're not good at the relating and getting somebody to, you know, express their feelings. And other people are good at that and not at the other. And one of the things I've often thought about illness, if you could kind of put together, share with other people. So with other people who are dealing with illness, maybe you're real good at the, you know, right-hand quadrants and the other person's good at the left hand. I mean, if there was some way to exchange effort or ways to find that, to help people with these kinds of things where they're not good with them, the areas where they're not so good. So anyway, those are two things that I've kind of come to in my own feeling about it. So there are other ways to care for people. We brought this up, respect their choices and their knowledge. Face your own shadow. So often, you know, where am I coming from with this? Am I wanting to get it all fixed so I don't have to worry about it, or do I have some sort of deep issue myself? Develop your own calm, healing presence, because there's nothing more helpful to a person than to be around somebody who is calm and healing rather than somebody who's kind of frantic. Help the person to see all four quadrants. If they're not dealing with an area, that's something you can do. You can just mention it, have you looked at this area, and so help them to see it. Do the detail work. If you want to suggest to somebody, some kind of supplement, do all the research, outline it, put it together very carefully so that they don't have to be turned loose into 15 articles. I mean, if you want to be helpful, be really helpful, do it well. You can take over other activities for a person, help them out. You can help a person enjoy life. You can just actually have a good time with them because, they don't want to spend their entire life thinking about illness. So, do things that are fun. And then, of course, you can work at the level of the collective. You can engage in policy. You can work within an institution. I mean, if you're a hospital administrator, you can have an enormous impact on the way things happen. In that context, there's a really terrific book that I read 7 or 8 years ago called Overtreated: Why Medicine is Making Us Sicker and Poorer. And it's one of the most balanced treatments I've seen of the medical system. It's by Shannon Brownlee. She won the Economic Book of the Year for it. It's very, very well done, very interesting about healthcare. So if you have a broader interest in that. And I don't remember what comment it was by Ken that I was going to mention.
When he went, and the doctors that went to investigate what he did. The doctors that went to the lake to investigate what happened.
Oh, well, that was I wasn't actually thinking about that. Yeah, when the Lake Tahoe CFS epidemic happened, there were people from the CDC who were brought out to investigate this. And they spent one morning reviewing records and the rest of their time skiing. And they went back and just trivialized the illness completely. It was given no attention, no respect whatsoever. And it was treated that way for probably 20, 25 years. My son got sick the year after. He's with us, by the way. He wanted to come today, but he's here on Skype. So for decades, nobody gave any real attention to this problem.
Well, I can say another thing about the book that I'm reading. There's a doctor that was doing her PhD, and in the cafeteria, she overheard another 2 doctors talking about this patient that had a radical remission of a cancer. So she paid attention and she asked them, and she said, yeah, so sometimes that happened. He said, where's the literature? No, we don't publish that. So she made her career to look into these radical remissions. There's a book they just published a year ago. It's called Radical Remission. In it, she says that she talked to several doctors. I don't have the number exactly. I think it was like 500 doctors, oncologists, and asked them, have you seen in your practice one or more patients that cure themselves without the treatments that we do? And they say, oh yes, we have. And the next question was, have you documented that and published? And they say, no. So she said, well, this is something that I cannot understand. So she went and she dedicated her life to that and interviewed more than 1,500 patients. And she found 47 different things that these people do, out of which 9 everyone does of people have radical remissions. And her book is about that. She has so the book is called Radical Remission. And it talks about the 9 components that patients do in order to have a radical remission of cancer. So if any one of you is interested, that's a book that you can read.
Yeah, thank you. Okay, so another thing is illness can be a spiritual path all by itself because it takes us into some of these really deep, intense emotions, fear, denial, grief, those kinds of things. It forces us into places that we could avoid otherwise. It requires us to live with our own suffering or someone else's suffering instead of running away. So all these things are in our face. It can change our beliefs relative to medical treatment, social services, other people, ourselves, and God, or whatever the kind of greater thing we think about. It can open our hearts to love, gratitude, and appreciation for life. And one of the things that really makes you appreciate every day is when you think that it might be limited in some way. Aging brings that on anyway, as many of us know, but an illness can really put it there. It also encourages us to consider these big questions in life. Who am I? And how should I live? What's important? And what is the meaning of life, death, and suffering? All those questions are basically spiritual questions and have to be answered at a different level than just the practical. And also we can transcend illness. I think one of the lessons I've learned is to see through the illness and to the person, because at first it's very hard. When a person has an illness, you react to that. It's like you're reacting to the illness, but to see through that to the person. And also you can see through to the depths of life. That illness can provide you with that kind of space to look through and see. So it can be, you can look at it as opaque or you can look at it as transparent in a way. And then the idea of surrendering into and accepting whatever is going on. Surrender is a practice in itself. And Kristen Kirk said something when she was here that I really stuck with me. She said she's a big proponent of surrender into whatever it is. I'm angry, that person, surrender into it. This happened, surrender into it. She said, I have found there is always something better waiting on the other side, which I thought was just a beautiful way to think about it, because these things we surrender into are obviously difficult, or we would have already surrendered into them. So taking something like an illness, or like our own inability to help, or anything like that, and just surrender into it. Just say, this is how it is, and accept it. We come to a different place in ourselves after that. So Francis Bennett, who is going to be here in December, putting on a number of events, so hope you can all come to that, he tells a story about a woman who had terminal cancer, a very terrible kind of cancer, and he was hospice. He would work as a hospice chaplain, and he went to the woman's home on a regular basis, and he said that when he would go in, she would start her litany of, why me? Why has this happened? How can it, what about my children? And she would go through all of the pain of this illness, and he would listen. And then one day he said to her, you've been presented with a koan. And most of you know a koan is a spiritual puzzle, which if the person can solve it, it takes them to enlightenment. And he said, you've been given the koan of illness. And how are you going to address that? And I think that's just a beautiful way to think about it. I think we each need to answer that koan for ourselves, and I think our society needs to answer it collectively. What is illness all about? Why is it here? What is it for me? How do I deal with it? And Adyashanti says, paradoxically, to face the totality of life, we must face the reality of death, sorrow, and loss as unavoidable aspects of life. Can we directly encounter this tragic quality of life on its own terms? Because if we can, we'll find a tremendous affirmation of life, an affirmation that is forged in the fierce embrace of tragedy. And if any of you know, he himself has a serious illness, devastating pain that will show up, and he doesn't know when, unpredictably. So he speaks from knowledge himself. So just to go back, why an integral approach to illness matters. It's a fundamental part of being human. It's not something we can ignore. It takes place in every quadrant. It takes place at every stage. It affects every type and every line. Everybody is affected by illness. And integral life practices at the level of body, mind, spirit, and shadow can help us to bring some light into each one of these areas. And also people I love, people you love, are suffering from our current fragmented approach. So we need to bring it out of the shadows, and we need to put ourselves in there into every corner of this problem and deal with it in an integrated way. So that's all I had for now, and I thought we can just, that's all. That's all I have to say. But I was thinking we could talk about any aspects of this, and I am going to do a kind of a course, and I'd just be really curious about aspects of anything I've said or anything else you think ought to be in that course.